Thank you so much to our panelists as well, and to all of you for joining today, whether you are a provider and especially if you're a patient. It is not easy to sit through a webinar like this for our long COVID patients, many of whom that I've interacted with in our studies. And I just want to say thank you so much for taking the time to be part of this today. My name is Andre Kumar. I am a long COVID researcher. I am one of the co-PIs or co-lead investigators for the Recover study at Stanford. And I also am the lead investigator for two interventional clinical trials we have for long COVID at Stanford. And what I'll be talking about in my closing remarks is the current state of long COVID research, as well as the future steps that we have planned in the next couple of years. The Recover study is a huge intervention done by the National Institute of Health, over $1 billion, and we've been able to recruit over 30,000 participants in the last 3 years. And we have three separate cohorts that we've been able to establish. This includes adults and over 12,000 nationally. Stanford has over 1,000 of those. Children and adolescents, over 15,000, as well as pregnant individuals with over 2,000. And there's also an autopsy cohort. And through the Recover study nationally, we've been able to collect samples and interventions and surveys from individuals ranging from all different ages, races, and ethnicities across the entire country, as well as territories in the United States. And the Recover study has several key questions that are very pertinent to patients as well as providers in the giant research and scientific community that is looking into this. Particularly, what does recovery from COVID and long COVID look like for different groups, from adults to children? How many people keep having health problems long after they get COVID? How many new people develop new symptoms after COVID or new problems? What are the causes of these problems? Why do some people get these symptoms of long COVID and these findings and some do not? And what does COVID do specifically to the body? What are the biomarkers? What are the physiologic, pathophysiologic changes that we're seeing that can result in the issues that we're observing in our patients? And over this time period, the COVID initiative through Recover, we've been able to collect a tremendous amount of samples. We have over 100,000 surveys from our adult cohort, over 1 million biosamples, including laboratory results, and over 37,000 blood tests. We've also been conducting office visits, smell tests. There's a study that we'll be publishing about that very shortly, as well as scans, not just chest scans, but brain MRIs. We're also doing other tests such as lumbar puncture to sample the fluid to understand why some individuals have cognitive symptoms related to long COVID and brain fog. Similarly, in the child and pediatric cohort, we've also been able to enroll a lot of participants and collect samples from them. We've had over 20,000 surveys, 5,000 office visits, and over 60,000 laboratory and blood tests that we've been able to collect as biosamples from it. And collecting data is one thing, but what are we actually sharing out with the community? What is actually being resulted from this research is really important. The Recover study, we've been able to publish over 115 studies so far. I've included a QR code here, so feel free to scan it. You can look at what the research is being put out every single day, every single week regarding the study. And currently, we have 131 studies either in process or being submitted. Most of the current literature that's out there from the Recover Initiative specifically focuses more on who gets long COVID, how do we define long COVID, what are the risk factors for it, and some of the initial blood tests that we've been able to accomplish through the study. And now we're entering a very, very exciting phase where we're also going to look at more deep dive tests such as CT scans, brain MRIs. We also have planned bronchoscopies, all these different tests that we want to do to understand long COVID. We also have interventional clinical trials. It's not enough to just understand potential biomarkers or risk factors for long COVID, but what are we actually going to do about it? And that is a key feature of the Recover platform. And through the Recover Initiative, we have over 2,600 participants across 5 categories I'll talk about shortly, and over 100 sites across the country. Some of these trials have actually just finished up enrollment. Recover Vital, which was looking at extended course Paxlovid, was recently complete. Recover Neuro was also complete. And then there are three current trials. If you have patients or you're a patient, you're potentially interested in learning a little bit more, there's three active ones across the country. Stanford is also site for these three. These include sleep, autonomic, and energize, and they're still enrolling. And these five studies focus on key areas that we want to answer through the long COVID scientific community. One is viral persistence. So, who continues to have consistent and persistent virus long after we think the infection has resolved, and why is that occurring? Individuals with cognitive dysfunction that we've already been talking about, such as brain fog, memory changes, slowed attention, autonomic dysfunction, sleep disturbances, as well as exercise intolerance, fatigue, post-exertional malaise. These are the five categories that we focus on in the study. And as I mentioned, two of these studies have already been completed. We have Vital and Neuro. We expect those results to come out later this year. And if you want to keep up on what some of these trials are doing, what the results are going to be published, and what the enrollment is looking like, there's a website that I've shared on these slides, and feel free to join those. In addition, we also have a new initiative announced by the National Institute of Health that's called Recover Treating Long COVID, or Recover TLC. This is going to be an entirely new clinical intervention platform that's going to start this year. And we're looking at over 100 active therapeutics. And these will be clinical trials, randomized trials, looking at different therapeutics, understanding does it improve patients with various symptoms or clusters of symptoms for long COVID. And we expect that we'll announce in the fall our first trial related to that. I also want to put out a couple of additional resources that are out there, particularly for our clinicians or our patients as well, related to treatment for long COVID. The AAPM&R guidelines on clinical care, these have been developed. I've included a QR code. You can scan it, or the website is below it. These have a great repository of suggestions for the care of patients with long COVID. And then I would also like to highlight the Canadian guidelines from our sovereign nation to the north, a completely independent country of Canada. They also have put out post-COVID-19 conditions and care guidelines, and I encourage you to look at that as well. And finally, I just want to express a huge amount of gratitude to all of the individuals on the front line, both treating patients with long COVID and to the patients and the advocates for long COVID. One of the questions I often get asked related to this line of work is, are you worried at all, particularly in the current environment when it comes to research and studies related to long COVID? And if you had asked me 2 months ago, I would have said, yes, I'm very anxious about it. I don't feel anxious about it right now. We have a lot of buy-in from our current Secretary of Health and our current National Institute Director, who view long COVID as a chronic condition that affects tens of millions of Americans and has very important implications on their health over the long term. And these individuals, our health secretary and director, have continued to invest funding into the Recover studies, long COVID interventional platforms, such as Recover TLC, treating long COVID. And I feel much, much better about what the state of research is going to be for long COVID in the future. And we're really, really excited and eager to continue to put out all of the research that we can. And again, just thank you so much to all of the patients and the advocates for really being a huge part of this community, particularly with Recover. We have a huge patient advocate community who has just been so instrumental in helping us as researchers understand on the ground what is needed for them to design and implement these studies. With that, I will end my remarks, and thank you so much for attending today.
Thank you. And everybody, please fill out the poll. If we could activate the poll, please. And please take just 2 seconds to answer the 3 questions. And then thank you so much for your attendance. Dr. Bonilla, final word.
Yes, I want to thank everybody for this successful event, and especially for the organizers, and they are behind the scenes, and we don't see the faces, and they are the one to make the things to be possible. To the speaker for these wonderful, wonderful presentations. And I learned a lot for this presentation. I hope the audience learned significant. and for the audience for the question they put into the chat that make this a whole conference very dynamic and relevant. We are hoping to see the next presentation for the public. We are going to maybe share a similar symposium on this kind of population. Please fill the poll because it's very important that we learn about our experience and how much we can contribute for future lectures and conference like this one. Thanks so much.
Thank you so much, everybody. Thank you to Dr. Kumar as well. Thank you.